Ladies and gentlemen, and now we are switching the topic, and I would like to invite our next panelists to the stage. Please give them a warm welcome. Dr. José Ferrer Costa, MD, Innovation and Project, Research and Education Teams at Badalona Serveis Assistencials. Hello. Alex Templeton, CEO at Qured. Guy Dickinson, Head of Employee Experience at Novartis, and the moderator of the panel, Laura Stembridge, founder and CEO at LED, the InsideOut. Please give them a warm welcome. Mindful workplace with employee wellness tech. Enjoy.
Cool. Good morning, everybody. My name's Laura. I'm the CEO founder of Let the Inside Out. I hope everyone is feeling bright and alert this morning. I think there were a few vodkas had last night, I hear, looking at my panel in particular. So we're just going to start by, I'm going to ask the panelists to introduce themselves. So over to you guys. Name, who you are, where you're from, and what's your greatest achievement in life? I love a deep question to get these things going.
Hi, I'm Guy Dickinson. I'm Head of Employee Experience at Novartis, based in Switzerland. I was thinking about this question, and I'm not sure I can talk about a work question. I think it's actually about relationships. So I'm happily married. I've got a daughter, and I think those two relationships are obviously the most important in my life, and actually that's probably what I'm most proud of.
Morning, everyone. My name is Alex Templeton. I'm founder and CEO of Qured, a preventative healthcare business based in London. Big question, obviously, spanning personal and professional life. But in my professional life, I think it's been navigating a very volatile and changeable market over the last few years, particularly through COVID, and taking a company through that, pivoting and making success out of it. So that's probably professionally my greatest one.
Hello, everyone. I'm José Ferrer. I'm a medical doctor. I've been a GP for over 20 years. And professionally, maybe my biggest achievement is being the unicorn in the room, normally, in the conference I go, because I'm normally the only clinician in the panels. But because 4 years ago, I started developing with VR, so I went into the technological part of my own research project. And now I'm managing research projects and clinical projects with VR mostly. And the biggest one is for healthcare workers' burnout prevention. That's why I'm here today.
Great, thanks, guys. So I think a lot of these panels can sometimes get a little bit dry and a little bit static. So we're going to ask for audience participation today, just to spice things up, spice things up a little. Can't speak this morning. Bring a little bit of life to things. So I'm going to ask everybody to stand up in a moment and turn to the person next to you and introduce yourself. So who you are and why you've come to the conference. So after 3, everybody up on their feet, and let's go. A little bit of networking.
Yeah, I mean, I'll take it. More fast.
Bring the chair in, it's just a bit more.
Yeah, it's true. They're gonna.
Do you want to sit in the middle?
You're not facing the audience anymore.
Swap.
Give us time to reorganize. I think we should go.
That's 10 minutes of the panel.
I'll just give them another. Okay, 5 more seconds. Okay, and when you're done, I'm just going to ask you all to take a seat again. Okay, great. Well, hopefully we all know each other a little bit better now, and you've met somebody who you haven't met before. Just to help guide the conversation, it'd be really useful if we could get a sense of who's in the room today. So if you're a startup, could I just ask you to raise your hand? Okay, perfect. And if you're an investor? Okay, corporate? Okay, good. And anybody else? I think there were about 6 other
Like
colours.
startups, the investors are over there. So.
Okay, great, perfect. Well, we're here today to talk about the mindful workplace and what the future of workplace technology and wellness is going to look like. So I'm just going to start the conversation by asking, what's the current state? Where are we at the moment? What's the benchmark look like? So I guess over to you guys.
Well, I can maybe talk a little bit about that. And I'm here in a personal capacity, but I can talk about the kind of Novartis journey a little bit. I'm head of employee experience. I have a colleague who's head of well-being, and asked him to talk about, to me, and brief me a little bit about this. And I think the dominant theme that he sees just with peer companies as well, large multinational companies of 50,000 plus employees, is an evolution from being full kind of wellness, nutrition, and when the pandemic hit, that actually there's a higher focus and an emergence towards focusing on mental health. And us as a company, that's exactly the journey we've gone from a very holistic overall view of thinking about well-being to being very, very focused on bringing on mental health in the workplace.
Something that we're hearing a lot from clients at the moment is that they've wanted to do right by their staff. They've wanted to invest in a number of different programs. So traditionally, private medical insurance, EAPs, increasingly mental health apps, and a number of other programs across the corporate wellness space. There's never really been, for many of them, and big companies, you'd be surprised, will admit this, there's never been a great strategy behind it. They've got a bit of this, one from here, one from there, put it all together, with absolutely no sense of what the outcomes are from that investment they've made. And a number of them are coming to the realization that, even though they've spent potentially millions, there's not necessarily a tangible output to them. So I think businesses are starting to look a little bit more strategically at it now and understanding how you can really measure those outcomes for the first time.
That's a classic kind of evolutionary curve of how software or even any initiative really, in my experience, gets put into large companies. There'll be some sort of trigger or stimulus for it. Reaction goes in, and then, actually, what do we have here now? Start to do that. So that's probably on a fairly natural curve. Do you see it sort of speeding up, or is that a pretty standard way that you see those things?
Yeah, it's clearly a maturity curve in terms of adoption of these technologies. And I think, frankly, most people are lagging, as I say, big names. People you would expect to have a little bit more of a robust strategy around it. And then there are the outliers who are using the adoption of a built-out, fully realised wellbeing program as a differentiator, as a key piece of their employee value proposition. But they're few and far between at the moment in the UK anyway.
Why do you think that is? Because I think a lot of the conversations we have with people, you always get those outliers and the early adopters and the innovators, and then you'll get those that are happy with the status quo, so the EAPs, the private medical, the PMIs, and so on. Why do you think people are happy with the status quo and they're perhaps worried around adopting some of these new technologies versus those that are happy to be outliers and put themselves out there? I'm just wondering sort of around the motivating factors for both parties, really.
Well, when we're talking about wellness in the workplace, there's a lot of stigma in the mental health of general people, especially in healthcare workers. It's a very big problem. So I think it's a necessity. We're seeing that the burnout in all fields are impacting the business. So, of course, the employers, they need to do something. They need to take action because they're losing money out of that. But for the users, that would be the workers, there is a lot of resistance to new technology because they feel it like it's a new skill they need to learn. It's something else they need to invest time. And they are already burnout because they lack time, there's a lot of workload.
I think there's a difference between a company investing in, say, a mental health solution and then uptake as well by the associates or in that company, right? So was your question more about our companies investing in this and or our employees engaging with it? Or?
I guess I was just trying to get to the bottom of, why are some people scared to invest in it and why are they happy to continue with what they've already got? And it's almost like a tick box exercise of we've done that, is it a tick box exercise of we've done that and we've got that base covered? Or is there worries about liability or anything else that's stopping them from entertaining some of these newer concepts? Or do they just not know about what's out there at the moment? I guess there's a few reasons.
I think that's part of it, actually. You speak to a lot of businesses, you're always competing with, the other people in your market and you feel that everyone knows who they are. No one knows who any of us are. That's the interesting thing, particularly with emergent technologies. People haven't even heard of the solution before, often, let alone with the competitive landscape. So that's been a real eye-opener for us. When it comes to adoption and why companies would invest in these kinds of solutions across the physical gamut, across mental health as well, often there's a financial imperative because these are businesses. So we have seen, particularly in the UK, it sounds like Italy has similar challenges. Perhaps we're a bit of a canary in the coal mine with the NHS when it comes to healthcare systems in advanced economies and how they're struggling. That worsening, deteriorating access to healthcare is really having a significant impact on working populations. And I was sitting at the back listening to a panel yesterday, and they're talking about 8 million people waiting for treatment on the NHS. Well, I remember putting a deck together less than 12 months ago, and it was 6, and then had to update it, and it was 7. And then the government put their flag in the sand and said, they shall not pass. We're going to get those numbers down, and they couldn't. Because these are long-term, the outputs of long-term structural issues. So it's that impact on workforce health, significant numbers of staff dropping out of the workforce for significant periods of time. It's a huge problem for the government. Those people move over from the taxpayer column to the welfare recipient column, and the NHS isn't able to cope. So they are increasingly investing in solutions that can help keep people well. And one of the other drivers that we see often is when a senior leader or executive within a business has a critical health issue, something like a cancer diagnosis. We've seen publicists or an early heart attack. Often you'll see investment on the back of that personal experience as well.
Yeah, I think we've seen the same with InsideOut, actually. And just to put some statistics on some of those points you made there, 1 in 6 adults are on a wait list now for mental health treatment. 75% of Gen Zs have left work because of mental health challenges. And at a time when war for talent, finding good talent, retaining good talent is at the highest it's ever been in recent years. It's a huge cost to businesses. But yet we're still seeing this kind of, for some companies, like, oh no, we've got what we need and we're not willing to kind of make that jump. So I think there's something around educating businesses and probably educating HR and in particular finance teams, because that's often where we get blockers. You get the HR champion, you get the C-suite champion, but as soon as it goes to the finance teams, it gets blocked. So how do we overcome some of those challenges?
When I was swatting up for this, I was reading there's a Deloitte had run a report, which I think was published in 22. So there was a little bit of a lagging indicator, perhaps, or data from the pandemic. And I'll just read this out. They found an average of £5.30 return for every £1 invested in workplace mental health interventions. So they've quantified the ROI, essentially. We had a conversation over dinner, didn't we, around this. But also, not in this report, but generally in organizations, there was there was about a 5% uptake globally of apps that are regarding mental health. So that's incredibly low uptake. And I don't know, and I can't remember where I got that data from. Is that something that you've seen amongst your customers or other organizations or generally in the industry, that very low uptake of these, and maybe what some of the reasons are? So we've got this kind of dual, or this paradox or tension really between, there's a clear ROI, we can see the macro level of this effect of mental health on the workforce and the costs around that. Companies are investing in it, but the uptake, if this number is to be believed, is extremely low. And is that something you've seen?
Yeah, I mean, when we speak to corporates, often, by the time people engage in a program that the company has invested in, they're at a point of crisis. And so actually you might see uptake in the low single-digit percentages across EAP programs, across mental health support programs. So I think the challenge both for the employer and the suppliers is how do you get people to engage with them earlier before the point of crisis and make them more widespread? And I think that's been quite challenging. And, we know that during COVID, everybody panicked about, everyone's extremely concerned about their employees' mental health. They invested in all of these programs on multi-year contracts. And actually, as they come up to renewal, I believe, from my understanding, that's quite a big challenge for them around those uptake numbers. So it's definitely something that we see. So for us, it's about creating consistent engagement early on. We're more on the physical side of the coin. Obviously, mental and physical health are two parts of a whole. And we're just trying to drive engagement and drive get people to think about about their health proactively on a consistent basis.
You provide diagnostics services for companies, and so mainly, I guess that's blood work and other aspects. Do you do a mental health check as part of that diagnostic process?
We don't currently. We are in quite a privileged position because we start taking quite a lot of health data about people through questionnaires and through interactions with our clinicians. So we provide all the wraparound care and clinical support around inclusive screening programs that we run. And actually, that's a trigger point where you can actually ask people quite interesting questions. That kind of door handle conversation at a GP where someone will come in for one thing, but and then at that point, you can signpost them into other programs that company may have invested in. So I think it can work quite symbiotically with those solutions.
Is that something your solutions does?
Yeah, so as part of InsideOut, we started off providing online therapy in 2019, pre-pandemic, and the uptake has been really good. So the EAPs, the Employee Assistance Programs, which are the generic call centre helplines, get around 2 to 3% engagement on average across the industry, and that's for physical health, mental health, financial health, legal support, and kind of all of the pillars of health. And just to give you an idea, on average, we get around 20 to 30% engagement with InsideOut. It does drop off after about 12 months, but we'd expect that is those that need support use it immediately. And then, it's kind of a case of, unlike a piece of HR software where you want people to be using it continuously, we only want people to be coming to it when they need it. And that's something we obviously have to educate HR managers and stuff about, because they'll be ask the question, we had loads of users to begin with, but why has it dropped off? And well, actually, that's a good thing, because those that needed the help and support got the help and support. So you'd always expect a spike to start with. And then it sort of plateaus as people will go through different points in their life, different journeys, different things will come up for them, whether that is relationship-based, family-based, work-based, and so on. So you will expect kind of a natural wave, I guess, of engagement. But we ask diagnostics as well, actually, to just kind of continue on that point. And we give a report back to companies so they can see what the triggers are. So all the data is completely anonymized, but if you can see that a company is particularly troubled with burnout, then we can make those recommendations to HR managers to say, look, here's the trends this month, and you've got workplace bullying or burnout as a major issue here, then we can help to guide where they need to focus their efforts in terms of educational support across the organization.
So that's the kind of evidence that you're building up to convince the HR to invest in this kind of programs. Apart from the engagement, what are other variables or what other evidence do you build with the app? And I'm asking you too.
For us, we design custom screening programs. So for taking a lot of data about each individual employee, who's the end user, we look at their family health history, their risk factors, their health hopes, fears, we'll have them, and also obviously their demographic data. And using that data, we have a recommendation engine, which essentially designs a custom plan for each individual. And we then do the clinical management around it. So it could be as simple as we find out, you don't look like you do, but you might have elevated cholesterol or low ferritin, whatever it is. And what we will then do is work to clinically manage that individual and retest when required if there's a borderline abnormality. And then we can demonstrate really through that testing and the longitudinal health data that we generate how we have affected in the near term the health of the population. And then if anything requires onward investigation, we'll make that referral into secondary care. We will then close the loop on the outcome of that secondary referral. So we have that data back, what happened. And then we get time series data of outcomes, essentially. And then we aggregate that, anonymize it, and we can serve it back to the population health manager to help them understand how their health is trending over time, what the ROI of existing programs is, what the ROI of the Qured program is. And we can really prove these things out on a quite granular biomarker by biomarker detail, but also a much bigger holistic picture of those workforce health analytics.
Yeah, and we're moving into the holistics side of things as well, understanding that the physical health and mental health are interrelated. So I mentioned a second ago that we had started off with online therapy. We're now moving more towards using AI to be able to run diagnostics, so bringing in data from health kits on phones and wearable data So looking at the physical markers and then using that paired with clinical diagnostics to be able to personalize the recommendations that are coming back to employees now. So whether that is a micro course on sleep, whether that's a macro immersive course on stress reduction, or whether that is, in fact, the need for intervention with a human therapist. And I'm differentiating there between human therapist and macro programs or interventions, because those, the former, so the macro interventions, will be delivered using AI avatars. And I think that's the future of where we're going, and using new technologies to be able to provide highly scalable solutions. And that's one of the issues we're seeing in the industry at the moment. There's just not enough therapists around. And so there's 1 in 6 wait lists on the NHS. Insurance companies no longer able to meet service level agreements because it's the same pool of therapists that are servicing both public and private health. So how do we combat this issue? We need to start looking at how we can use future technologies to be able to service some of these new interventions.
I mean, your intervention's VR-based. You're talking about agent-based. I mean, both of these. My question is really: do they remove some of the stigma and increase access in terms of the therapies? And what's been your experience in terms of?
I think accessibility is very important, especially in workplace like healthcare, that you lack time. So having some kind of intervention that is individual and on demand, you can just go out of your consultation or you stop work for 15 minutes, put on a headset, and have your relaxation or your program. That helps a lot, the implementation. But I was really interested in, have you, any of you get to the impact of the results in the work? How is it impacting the results of your interventions in the actual workplace?
Yeah, so we have been running a study with one of our organizations and looking at the data that we get in terms of how effective people are finding the interventions, couple that against the data that you get from absenteeism, for example, team morale. So we have a survey that we run pre and post to measure impact assessments. So we kind of run this survey at the beginning, so we get the landscape of where the organization currently is, and running it by a third party, you get a much more truthful response. I've done employee wellbeing surveys myself, and I'm always like, yeah, everything's great, and you never quite know whether Big Brother's watching you or not, but and it might not be great. So yeah, we find that you get a lot more truthful responses with the survey, and then we run it again after 12 months, and we've seen employee NPS, so net promoter scores, increase dramatically. So we had one that went from plus 14 to plus 74 within a 6-month period, and the only benefit they'd rolled out was InsideOut and mental health support. We've seen team morale increase, we've seen productivity go up, and that's been measured by way of outputs across the organisation. And we've seen the number of leavers reduce as well.
On our side, we found the greatest need is with employers who know they have a problem. So we've been working with a national infrastructure provider who was aware that they had very high incidences of diabetes in their population, hypertension. They were suffering from extended sickness absence from a significant proportion of their workforce. And so we ran some screening programs with them across, we call the silent killers, cardiovascular disease, cancer detection, and diabetes, and some more kind of lifestyle-related screening around perimenopause and a number of male health indications. And it turns out they were very unwell, and there was a reason why they called us. And we made, from the first, I think, 600 or 700 people we put through the program, we had an urgent referral rate, as in it couldn't wait, had to be done within 2 weeks for 8% of the staff. So who were at significant risk of life-threatening disease and life-limiting disease, who would have had no idea because they skew male, they skew older, they skew sedentary, they skew overweight. These are not people who engage with their GP and the healthcare system regularly. So I think giving people a wake-up call sooner than them crashing through the NHS's doors in their 60s with, multiple comorbidities is actually really important and valuable. And the next stage for us is the so what, to your point. How do we help that individual manage their health back into a healthy range? And also, how do we help the employer create the right interventions to actually improve their population health?
So you think it's an obligation and a duty of the employer to take care of the health of the employees, all right? And also, it's necessary.
I think it's shifted significantly since COVID, that compact between an employer and their employees' health. They've started taking responsibility for it in a way that they hadn't before, and that's being accepted by employees. And in fact, increasingly, as gaps increase and open up within state healthcare provision, there's a duty of care for employers to provide that support, I believe.
What about having burnout as a measurement of quality in the workplace? That could be interesting.
Yeah, I mean, burnout's rife, right? That's something that we see a lot on the markers and the questionnaires and the surveys that we do. And burnout, I think it's a softer term, rather than saying I've got stress, I've got anxiety, I've got depression. There's still an element of stigma around that, and we see that today. You walk into the city in London, and there's still that perspective of you just get on with it. It's the ability to speak up freely, and I don't want to be stereotypical, but particularly in guys, we're seeing that there's still a lot of stigma there. But burnout's a lot softer, and it's almost more, sort of acceptable. I hate using that word because it should all be acceptable, but burnout does come with a lesser connotation, and so we are seeing an increase in people saying that they feel burnt out. So the question back to the organisation is it okay for your employees to feel burnt out, and are you happy to stand there and say, I've got an employee assistance program and I've got a private medical, we're done. It's totally fine. This will cure everybody, and if they've got burnout, then fine. Or is there an opportunity to say, okay, great, how can we help you? And let's look at new and alternative ways to be able to support colleagues so that they can manage the burnouts and try and prevent it, because I think we've got to move into a preventative mindset rather than a treatment, and be proactive rather than reactive in the interventions that we're providing to our teams.
I was just fascinated by your story around that employer, which my assumption is that these emergencies and these health issues are demographic and a whole set of factors, many or none of which would be actually directly correlated to their work that they do themselves. But yet the employer takes what I think is a very reasonable and obvious kind of intervention there. So it's sort of an interesting change in dynamic, I guess, of how employers think about that. I guess there's a broader macro question around what if the whole set of factors that cause stress in the work, or self-reported factors that cause stress in the workplace, at home, relationships, finance. There's a whole spectrum of things, but workplace is definitely one of the primary causes there as well. So what can companies do if in a holistic way to think about that problem, as well as providing some sort of interventions and ability as well, and what's the duty and the morality there and so on. Questions I don't know the answer to, but I think it's interesting that we're even able to have a conversation now. And perhaps we were talking, 20 years ago, this wasn't even on the agenda. A CFO would never sign off on any of these kind of things at all. So.
Yeah, I think we're down to the last few seconds, but it's an interesting way, I think, to wrap this up. So I guess trying to summarize all of those questions, which are really great questions, and let's carry on debating those for the rest of the conference. But where do we see the future of mindfulness, workplace, technology going, and wellness tech? What does that look like? So by 2030, where are we going to be? What does the future hold for us?
Well, technology is definitely here to help, because it gives it a new tool that can reach a lot of more people in less time, with less cost. It's very beneficial for both the company and the employees. I think it's basic.
Can I tick off the AI bingo card? I think there's an interesting opportunity that is clearly a trend already, which is there's a mediated intervention through things like diagnosis, but also therapeutic questions, which are not involving humans, which enables much higher scale and also removes perhaps some of the stigma. And I think from an employee perspective, you'll have absolute privacy from employee. There has been absolutely no visibility of that. But that data will be smartly de-identified and be able to be connected to other indicators. And so employers will have a fabric of data where they can see absolute causation and correlation type measures across a whole range of factors around performance and these type of interventions as well. But I think the most interesting will be scaling this without humans. That's my hope.
And Alex?
It's exactly as you said, the way of squaring that circle between being able to roll out programs efficiently, create personalization, create adherence, and actually understand the data that's coming out of it in a meaningful way. It's been impossible to date, right? The technology has not existed. It is now emerging, and it means that it's going to be incumbent on every business to actually invest in this stuff, because it's going to be affordable and accessible for them for the first time.
Great. Great, and I'm just going to throw one addition out there, and that's virtual reality and augmented reality and the role that that's going to play. So having headsets available in workplaces, in wellness rooms, and being able to support colleagues in a much more immersive, almost gamified way, escape to beautiful parts of the world, the Maldives, the Northern Lights, quite like to be there right now, and practicing mindfulness and mental health interventions in immersive places. I think that there's something to be said for that as well. So, yeah. Great. Well, thank you so much to my fellow panelists. I hope you all found that useful and enjoyed the conversation. I don't know whether we've got time for questions, so I'm looking to see.
Actually, I'm just checking. Yes, we just received 1 additional minute for maybe one question or two, so let's try to make it brief. Are there any questions? Oh, yes, we have.
Hi, I'm Ahuti Rai. I work as a venture partner and strategic advisor. My question is coming from a place of being a volunteer mental health advocate for 6 years. And I will caveat this by saying I'm very pro-tech. However, how do we know, how are we going to detect if we've gone too far with tech? And I see the future, you know, the headsets, the avatars, the digital coaches. My experience of having helped so many people on their journey with mental health is the root of their trauma is actually isolation. And having a therapist has helped them build trust in humans again and helped them appreciate the value of dialogue and that natural interaction and having touch as part of that process as well. So I am very pro-tech, you know, I invest in some of this stuff, so I get it. But how do we responsibly make sure that we don't create another problem through treating this problem?
Yeah, it's a great question.
From a medical perspective, I think it's very important to know the limits, of course. I'm with you with the words. But you can use virtual reality or augmented reality to connect people also, because you have multiplayer options that you can connect the therapist with the person that's not really comfortable going out yet. And it builds then confidence to go out until they get to the point that they can go to the office or they can go to the therapist. So in a way, it's breaching this kind of loneliness and isolation. It can help with that, not the other way around. Of course, we have the other side that you are worried about is if someone gets too much attached to this technology and forget about the real world, and they only want to be connecting to people through this technology. But it's a risk that came with the internet and then with the iPhones. We just have to find the balance. We're not there yet. We're just learning how to use these technologies.
Yeah, and you're never going to replace the need for human therapists either. It's about supply and demand, and how can we reduce the demand on human therapists to help those that perhaps aren't suffering with trauma through loneliness or anything else that's causing them to feel disconnected from the world. But if there are people with mild symptoms, perhaps navigating through a relationship breakup, for example, a couple of sessions led by an avatar might not necessarily be a bad thing for them. But of course, those with severe depression and so on, you're absolutely going to need the human therapy, and that should never be removed from any intervention. It should always be in addition to any other technology that's used. At least that's my thoughts.
Definitely. Yeah, it's a tool. It's not an option. It's an addition. I think we have.
Thank you very much. Thank you, panelists, for this very important discussion. Thank you, Laura, for moderating. And thank you for this question. It was on my mind for the whole discussion. Very important one, I believe. Thank you very much. Big applause, of course, to our panelists.